And I think many of us would have talked about using combination therapy, but I think the key here is, what's the next step? And we can talk about that a little bit later. But we also need to talk about, maybe for our audience, about diabetes and cardiovascular disease. What do we know, Vivian, about diabetes as a cardiovascular risk factor?
Well, diabetes is clearly a cardiovascular risk factor. We used to call it cardiovascular risk equivalent. That is, people with diabetes have the same risk of a heart attack as somebody who has had a previous heart attack. We know now that that's not entirely true, because there's a whole spectrum of people with diabetes.
Right.
And for younger people who have had short duration of diabetes, maybe the risk is not as much as perhaps somebody who's had diabetes for 10 years.
Right, and we know that diabetes, has an increased risk for both cardiovascular disease. Congestive heart failure is one we're talking a lot about now. Cardiovascular death, peripheral vascular disease, and the old UKPDS data actually showed us that for every 1% A1C decrease, you decrease risk of complications by about 16% for heart failure, maybe 14% for MI, and for stroke, maybe 12%. So while glycemic control is not the main concern in terms of long-term lowering of cardiovascular risk, it still does play a role as we achieve better A1C results in our patients. It's surprising, though, that the NHANES data shows us that about 55% of our patients are getting to the goal of less than 7% with their hemoglobin A1C. But we're still struggling to get our patients with diabetes down to blood pressure goals and to lipid goals sometimes. So